So today, guys, I'm going to talk about traumatic damage to the nerves of the upper extremities. The three upper extremities, radial, and medial, and ulnar. I'm going to say treatment of them. Next, nerve injury in the upper extremity. Uh, Nerves are the conducts of information that run from the brain to the rest of the body, and vice versa. The upper extremity contains numerous nerves that transmit stimulation for functions such as the muscle contraction. The nerve that innervates the upper extremity leaves the central nervous system through several areas in the neck. It's called brachial plexus. The nerves are larger in diameter near the neck and eventually divide to form smaller branches in the upper arm, forearm, and hand. Next. Injuries to the upper extremity occasionally involve trauma to nerves, which can interfere with the various functions of the arm and hand. The nerve is contused and may heal. It may heal on its own, and its nerve can maybe need surgery. Next. The radial nerve damage. The radial nerve is one of the terminal branches of the posterior cord in the axilla. It lies behind the axillary and the upper brachial arteries, and the passes anterior to the tendons of teres minor. There's some signs that you can know the nerve damage. You can see tappiness or tingling in the hand and feet, feeling like you are wearing tight glove or sock. Your hand is very heavy and you feel like muscles weakness and sharp pains in the hand and arm. Next. Medial nerve injury, and the medial nerve injury is usually damage to either the elbow due to fracture of the humerus bone of the upper arm, or the wrist due to either carpal tunnel syndrome or wrist liquefaction or gashing. If the median nerve is damaged at the elbow lesion, it's known as proximal injury to the median nerve. This is the diagram. You can see like localization of each nerve, ulnar, radius, and median nerve. Next. Next is ulnar nerve damage. Ulnar nerve passes occurs when there is damage to the ulnar nerve. This nerve travels down the arm to the wrist, hand, and ring and little fingers. It passes near the surface of the elbow. It can cause pain and tingling. The ulnar nerve is what creates the shock-like sensation when you hit like the fine bone in your elbow. You may lose the sensation and you may have like muscles weakness, and this is known as ulnar neuropathy. Next, this here we can see the upper limb damage zone. We're going to just focus here on upper extremities that we're going to talk about the ulnar and ulnar and median and radial, C6 and C8 and C7. Next. Treatment for the injury of upper extremities. This treatment can divide into. We can give to the patient like medication, drugs, tablets. This like make the pain less, but mostly we can give the patient a neurosurgery to like make the pain less to the patient. Next. Thank you.